Good morning, how are you? Wish you are fine. I want to speak about silicone gel and the efficacy of silicone gel for the treatment of hypertrophic scars and keloids. Topical self-drying silicone gel is a relatively recent treatment modality promoted as an alternative to topical silicone gel sheeting. 30 patients with scars of different types, including superficial scars, hypertrophic scars, and keloids, were treated with silicone gel. Self-drying silicone gel have been satisfactory. Scars vary greatly in quality depending on individual and racial patients' features, the nature of the trauma, and conditions of wound healing. They frequently determine aesthetic impairment and may be symptomatic, causing itching, tenderness, pain, sleep disturbance, anxiety, depression, and disruption of daily activities. Other psychological sequences include post-traumatic stress reactions, loss of self-esteem, and stigmatization, leading to a diminished quality of life. Scar contractures also can determine disabling physical deformities. All these problems are more troublesome to the individual patient, particularly when the scar can't be hidden by clothes. This study was undertaken to verify the efficacy of a new topical silicone treatment, a self-drying separable gel that needs no means of fixation and can't be seen because of complete transparency. Silicone gel contains long-chain silicone polymer, silicon dioxide, and volatile component. Long-chain silicone polymers cross-links with silicon dioxide. It spreads as an ultra-thin sheet and works 24 hours per day. It has a self-drying technology and itself dries within 4 to 5 minutes. It has been reported to be effective and produce 86% reduction in texture, 84% in color, and 68% in height of scars. Silicone gel exerts several actions which may explain this benefit in scars. It increases hydration of stratum corneum and thereby facilitates regulation of fibroblasts production and reduction in collagen production. It results into softer and flatter scars. It allows skin to breathe. It protects the scar tissue from bacterial invasion and prevents bacteria-induced excessive collagen production in the scar tissue. It modulates the expression of growth factors, fibroblast growth factor B, and tumor growth factor. Tumor growth factor B stimulates fibroblasts to synthesize collagen and fibronectin. Fibroblast growth factor beta normalizes the collagen synthesis in an abnormal scar and increases the level of collagen, which breaks down the excess collagen. Balance of fibrogenesis and fibrolysis is ultimately restored. Silicone gel reduces itching and discomfort associated with scars. The advantages of silicone gel include easy administration, even for sensitive skin and in children. It can be applied for an irregular skin or scar surfaces, the face, moving parts, joints, and flexors, and any size of scars. A tube of 15 grams contains enough silicone gel to treat 3 to 4 inches. In general, it is 7.5 to 10 centimeter scar twice a day for over 90 days. The study enrolled 30 patients having scars. Written-informed consent was taken from all the patients before the study. Also, prior approval of hospital ethical committee was taken before the study. The silicone gel was applied at a thin film twice a day. It was wrapped with fingertip for 2 to 3 minutes. For fresh scars, treatment was started just a day after wound closure or after 5 to 10 days. The scars were evaluated at monthly intervals. The appearance of scar, including scar type, scar size, and scar color, was assessed by the physician. We classified hypertrophic scars as a red or dark pink, raised, elevated, sometimes itchy scars confined with the border of the original surgical incision, with a spontaneous regression after several months and a generally poor final appearance. A keloid is instead classified as a scar red to brown in color, very elevated, larger than the wound margins, very hard and sometimes painful or pruritic, with no spontaneous regression. Patients were observed and the results were compared at monthly follow-up. Examination follow-up was done for 6 months. All scars were measured and photographed before treatment onset. Scars were graded 1 to 4 on the basis of criteria. Final photographs were taken at this time. The results: 11 cases, 36.66% were in the age groups of 30 to 40 years. 26.66% case between 20 to 30 years. 5, 16.66% cases were between 40 to 50 years. 2, 6.61% cases between 10 to 20 years and 50 to 60 years of age each, and 1, it is 3.33% case of less than 60 years of age and between 5 to 10 years of age each. Male to female ratio was 2 to 1. It was also seen that most 40% of the scars were between 1 to 3 months duration. 26.6% of scars were of less than 1 month duration. 20% of scars were between 3 to 6 months, and 13.33% scars were of more than 6 months duration. The commonest type of scars were hypertrophic scars grade 3, which was 50%, followed by mildly hypertrophic scars grade 2, 26.6%, and keloids grade 4, 23.33%. Most of the scars were between 1 to and 3 months duration, 40%, and 26.6% of scars were of less than 1 month duration. 20% of scars were between 3 to 6 months, and 13.33% scars were of more than 6 months duration. After treatment, what happened? Improvement was noted in the scars. 60% scars were graded as normal, grade 1, while 20% were graded as mildly hypertrophic, grade 2. 20% of scars were of grade 3 and 4 at the end of the study. 10% in each grade. Side effects were a few allergic reactions to silicone gel was seen in 1 case, and mild desquamation was seen in 2 cases. So in general, there is a good efficacy of silicone gel. Topical silicone gel is safe and effective treatment for hypertrophic and keloid scars. It is easy to apply and cosmetically acceptable. That was all about silicone gel and the treatment of silicone gel for hypertrophic scars and keloid. I'm Dr. Bassem. Please make like, share, and subscribe to my YouTube channel.